Hey everybody, John Malanca with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA certified organic hemp and CBD brands, and all of its hemp is grown from the perfect topography and climate found in Colorado. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Welcome back, everybody. This is John Malanca with United Patients Group. Be informed and be well. Today we have a special guest and been on a few shows with us, as well as spoken at United Patients Group Baltimore conference in 2017, as well as joined us in our United States Capitol in Washington, D.C. for a day of education that United Patients put on. And this is Dr. Patricia Frye. She's a founder and medical director of Tacoma Southeast, located in metropolitan area of Washington, D.C. Her integrative practice focuses on the use of cannabis, cannabinoids, nutrition, and lifestyle choices in the medical management of chronic conditions such as pain, autoimmune disease, neurodegenerative disorders, autism, seizure disorders, and psychiatric illnesses. She is professionally certified by the University of Vermont School of Medicine in Cannabis Science and Medicine, and serves on the board of the Society for Cannabis Clinicians as chair of the Committee of Education. Dr. Frye is an affiliate for associate professor in medical cannabis science and therapeutics at the University of Maryland School of Pharmacy. She is an international speaker, sharing her vast knowledge and clinical experience in cannabis medicine with students, healthcare providers, patients groups, policymakers, industry leaders, as well as government agencies. She is the author of the book, The Medical Marijuana Guide, Cannabis and Your Health, which is an official reference resource of the University of Maryland's medical cannabis curriculum. Congratulations, by the way. After completing her pediatric residency, she trained as an anesthesiology at Baylor College of Medicine in Houston, where she gained experience in sedation, medical pain management, as well as pain management procedures. Dr. Frye also serves on the Cannabis Trade Federation's task force on diversity, equity, and inclusion, and has testified on a number of panels addressing cannabis legalization, regulation, and social justice issues on Capitol Hill, as well as the 2019 Democratic Caucus Issues Conference. Welcome, Dr. Frye, and great to see you as always. Thanks for being on.
Thanks, John. Thanks for inviting me.
Yeah, we've done a lot over the years, so thanks for always being open when I say, would you want to join me for this? And so that's good relationship there. So thanks for that. You covered a lot. I know you want to, you do a lot with pediatrics and you worked with epilepsy, and I know you want to discuss autism. That'll be another show. We just had someone on the show talking about autism. So I said, what's another topic that you want to cover? And you said, how about autoimmune diseases? And so I think that's a big topic that's affecting a lot of patients, and people don't realize autoimmune disease is not just one disease, it's a whole gamut. But can you share what is an autoimmune disease?
Well, an autoimmune disease is an illness where the body responds to, or the immune system rather, responds to parts of the body as if it were a foreign object, something that needed to be removed or eliminated. And so it really is an overly active immune system attacking parts of the body, and what parts are attacked depends on the illness.
And so when I mentioned, I mean, Crohn's is one of the most popular ones. MS, celiac disease, lupus, ulcerative colitis.
Ulcerative colitis.
Colitis, excuse me.
Mm-hmm.
Colitis. And but one I found out too is type 1 diabetes. I didn't realize that was part of that as well. And so what are some common ones besides the one I just listed there?
Those are common. There's rheumatoid arthritis is very common. Psoriatic arthritis, or psoriasis vulgaris, which involves the skin, fibromyalgia, Lyme disease, mixed connective tissue disorder, polymyositis, ankylosing spondylitis, myasthenia gravis.
Yep.
The NIH has thought that there are just a lot more autoimmune illnesses than what we recognize today. Mm-hmm.
You know, I had Beth
Hashimoto's.
Goss on here recently, and we spoke about fibromyalgia and how many patients are affected by fibromyalgia. How many Americans are affected by autoimmunes altogether? I mean, tens of millions?
Yeah, at least. The NIH estimates that there are at least, maybe 20, 30 million Americans who are affected by autoimmune disease. It's a very common condition. It's something I see quite frequently. And the number is probably higher than that.
You know, and I rarely use the word cure, but are any of these curable? Because I know fibromyalgia is something that really isn't. You can.
We don't use the term cure as much as we use the term getting patients into remission. And whether their symptoms come back, it's a matter of time. Oftentimes we can get symptoms to quiet down, and there are a number of pharmaceuticals that are used that can do that, but they don't work for every patient. And sometimes we see it in cannabis. Case in point, I had a patient with a very severe case of myasthenia gravis who had been on a number of medications. She would have to be intubated. She had a feeding tube. She had so many chronic issues. And after starting cannabis, things just started getting better, to the point where the neurologist said, well, I don't use the word miracle very often, but this is definitely in remission. And she has been pretty much symptom-free since that time. So it is possible to go into remission with an autoimmune illness.
You know, that is one that's getting a lot of attention lately, myasthenia gravis. I mean, before, not too many people even discussed about it. Not even people talked about, you know, cannabis. And so how did you, let's back up a little bit. How did you get involved with cannabis? Was it a personal story, or did so many patients coming at you, you're like, wait a minute, you know,
cannabis found me. Okay. I practiced in Southern California for many years, and cannabis was just not on my radar at all. And it was moving back to the East Coast that I was looking for a telemedicine job. And I was thinking more of an urgent care type job, but they called me about doing medical marijuana evaluations. And my response was, I don't know anything about marijuana. And they were like, well, you know, why don't you talk to the people? The implication was that you didn't have to know that much about it. So I was curious, and I decided to do it. I learned so much from these patients. I was doing these evaluations, 3 hours a day, almost every day. And at the end of the year, I had evaluated maybe 2,000 patients. And at that point, the experience had definitely changed any preconceived notions I had about who used marijuana and why. And I felt like this was a pretty remarkable plant. People should know about it, and people should have access to it. So I kind of came out of retirement and opened a practice and continued to do evaluations, but in person on the East Coast.
Yeah, it's funny. The very first time I went in to get a medical cannabis recommendation here in California, I think it was 2010. And I walked around thinking, who's going to see me walking into this place? You know, I was kind of, I felt like I was breaking the law. And I walked in there, and I saw everybody in every gamut. And there was a sign up on the wall that this is what your typical cannabis patient, actually, look, the sign said, this is what your typical stoner looks like. Mm-hmm. And it had a picture of a police officer, a teacher, a doctor, a parent, a mom, and looking around in the waiting room, that's exactly what I saw. And so from 2000 now to 2020, you've also, I bet, seen this wall go down of what this plant can do. And even when I present, I'll put up there on the slide, and I've talked about this in my show, I'll put a slide up there that has a roll of duct tape, and the audience looks at me like, I think you have the wrong slide up there. And I say, actually, when people ask me, does it work for this or does it work for that? I say, I don't want it's like it's a duct tape with uses, but when you really get down to it, it has so many benefits. And I never want to say, and like you, I never use the word cure, but it's not a one size fits all. And so it's not just because someone has fibromyalgia doesn't mean every single fibromyalgia patient is treated the same way, or rheumatoid arthritis or Crohn's patients. And so can you talk about that, what you look at when you do have an autoimmune patient that comes into your office, and what are things that you look at, and what can you share from some of our listeners that probably are going through this and really know nothing about the cannabis plant and how it works?
Well, I'm basically looking at alleviating symptoms that bring the patient in. There are a certain number of symptoms that are very common in autoimmune illness. Pain is a major factor, and it could be joint pain, it could be chronic headaches, it could be myofascial pain like in fibromyalgia, or abdominal pain from inflammatory bowel disease or celiac disease. So I'm usually focused on alleviating a symptom. So sometimes it's pain, most of the time pain is involved. Other times it may be chronic fatigue, it could be brain fog, insomnia, and then anxiety and depression are very commonly seen in patients with autoimmune illnesses. And a lot of that is I think just the stress of being sick all the time, of not feeling well, and dealing with chronic pain. We just with chronic pain from other reasons, we often see anxiety and depression. And then if the anxiety and depression aren't addressed, there's no way you can get up under the pain, because those emotions actually signal the release of inflammatory mediators, which add to the inflammatory response. So it's not just that people feel worse when they're depressed or anxious, it's that those emotions are actually stimulating or starting pain or making the pain that's there worse, and it's not their imagination.
Yeah. It's almost like a domino effect, because I've spoken to a lot of patients over the years, and sometimes if you relieve I guess the insomnia and the sleep issue, kind of everything else falls in. I mean, when we all don't sleep for a day or two for whatever reason, stress next morning, you're not sleeping, it affects you, and next thing you know, you're kind of spinning out, your anxiety goes up, your depression falls in. Is this something that a lot of patients are born with? Is this something as genetics that's tied to this, or?
I think people are born to be susceptible to it. Yes, there's definitely a genetic component to it. It doesn't mean that every child that's born into a family where they have autoimmune illness is going to have an autoimmune illness, but very frequently when you see an autoimmune patient, there's a strong family history, or at least there's some people in the family, usually in the somewhat immediate family, either a parent or a brother or sister who has an autoimmune illness. So there are certain genetic markers that they can look for. I don't know the names right off the top of my head, but there's more times than not, there's a familial component to this.
Gotcha. And then what's the difference between an autoimmune disease and an autoimmune disorder? Is that?
It's interchangeable. There really is no difference in the words. We just use the word disease for some. Disorder just seems to have latched on to other ones. But I look at the word disease as dis-ease. And when you're at ease, everything is in balance and in homeostasis. When there is dis-ease, that's when things are out of balance, out of homeostasis, and you have symptoms that are, for the most part, unpleasant.
Yeah.
And going back to sleep, I want to just point out how important getting 7 to 9 hours of sleep is. There is so much that the body does based on your circadian rhythm, that if you're getting fewer than 7 hours of sleep, there are a lot of hormonal shifts, a lot of inflammatory mediators that depend on you being asleep at night when the sun is down, when there's no light, in the dark. And people can underestimate just how important sleep is in managing pain and those emotions.
It is, you know what I started doing? Because I could go to bed at 2 in the afternoon or 2 in the morning, I'm still going to wake up at 5:30 in the morning. And lately, when I say lately, like in the last 3 months, 4 months since this whole Corona thing, in the middle of the night, I lean over and I grab a eye mask and I put it on. And you know what? It's kept me in bed until 7:30 sleeping. So the darkness, really helps. And at first it was just, I can't sleep with this thing on, you know, but it is so important. You talked about homeostasis and balance. Can you talk about how cannabis works in the body and with the endocannabinoid system and how it does bring the body back to balance?
Well, we have this endocannabinoid system that it's a neuromodulating system. It's in everything from jellyfish to humans. And the whole point of this system seems to be to keep everything in balance. And it interacts with almost every other neurotransmitter system. It interacts with our immune system. And it interacts with almost everything. And so when we don't have enough of a neurotransmitter or too much of a transmitter, that endocannabinoid system plays a role in either increasing the release of certain neurotransmitters or cutting some neurotransmitters off. So say in pain, anandamide, which is one of the cannabinoids that our bodies make, once the second part of that nerve fiber gets the signal that there's certain calcium ions that are coming in, there's maybe glutamate and cytokines, which are inflammatory mediators, that stimulates the production of these endocannabinoids like anandamide or 2-AG that travel retrograde back to the first part. You have these two parts to the synapse, and it shuts it down. It's sort of the body's way of saying, okay, we got the message, there's a problem, but you can stop now, we get it. So acute pain is necessary for survival because it's letting you know that something's wrong. Chronic pain is maladaptive, because you already know that something's wrong or something was wrong and it's long healed itself. And there's really no reason to be sending the signaling. So the endocannabinoid system plays a role in that. And when it's not doing its job, that's when you get into this chronic signaling that causes pain and discomfort. The same thing with anxiety and depression. The endocannabinoid system modulates how these neurotransmitters are released and activate other types of receptors. Let's say stress, for example. People, we need stress to survive. If there's an emergency, we need blood in our arms and legs so we can run fast. Just like a zebra, we need to outrun the lion. Well, no, we just need to run faster than another zebra. But the whole point is to get away from the lion. And so,
or run faster than who you're running next to, right?
Exactly. That's right. It's like my husband says, you don't have to run faster than the bear. You just have to run faster than the other guy, than the person you're with. But so the area of the brain that controls this, the amygdala, is usually in a quiet state. And it's in a quiet state because of anandamide. So when there's a lion, our Pha enzyme, which is the Pha enzyme, is what breaks down anandamide. It increases so that it decreases the anandamide so that we can have a stress response. We send a signal to the hypothalamus, to the adrenals, and we can run and we do everything we need to do to survive. Once that's over, that Pha enzyme is supposed to go down. so that our anandamide levels can come back up and put that area of the brain called the amygdala in a quiet state. When that doesn't happen, we get into chronic stress. And chronic stress leads to a lot of other physical and mental problems.
And with this illness and stress, chronic stress, do a lot of autoimmune patients that have this, are they more often getting sick than not?
Absolutely. Stress plays a big role in people's state of being, be it well-being or being in a state of dis-ease. So it's very important to try to control stress, or at least to cut that stress signal off when if you're not in a state where you need to run for your life. Stress is causing problems. It affects how we metabolize glucose. It affects how we metabolize lipids. It affects how we our energy expenditure. It's impossible to maintain, let's say, a healthy body weight if you're constantly stressed. At least for a lot of people, cortisol levels go up. It causes our insulin to be less effective. And that's how people develop things like type 2 diabetes. It can be a problem.
And so with this that you're seeing in your practice with all these different types of, I guess, autoimmune diseases, and it's affecting the immune system because of the stress. And are you seeing a lot of this more so in your practice right now, even with what's happening right now with COVID, not only in your practice, but in your circular with your family as well, family and friends? Because I'm seeing more people are getting into walking and stretching and meditation and Tai Chi. My mom's even getting it. I said, I think it's great, Mom. Let's keep the stress level down. So are you seeing that?
Absolutely. I have, since COVID, though, I have been doing telemedicine, but it's pretty consistent. I hear that patients' anxiety levels are definitely higher than they were pre-COVID. Their stress of daily living. We have people and sometimes there's a little too much togetherness. Everyone's home 24/7. You have, couples that are not, spent day after day after day without, some kind of break. The children are going to school. So everybody's a little stressed out, more so than usual. But at the same time, most of the patients that I'm seeing have been using cannabis and have been watching what they eat and trying to get their exercise and get that restorative sleep that's necessary to keep those stress levels and to keep that anxiety from wreaking havoc on their well-being.
With cannabis, can you talk how you would treat some of these? And for our listeners, this is not to replace a one-on-one with your medical professional. And so I would always recommend having a one-on-one with your medical professional or scheduling a consultation with Dr. Frye, as she was mentioning. But can you talk about some of the benefits, how cannabis works with the body in treating a lot of these autoimmune diseases?
Yeah, well, both CBD and THC are immunomodulating, meaning that there's some inflammatory mediators that go up when these receptors are activated. There are others that go down. But at certain doses, particularly with CBD, when we get into some higher doses, we sometimes see what we believe is more of an immunosuppressive action. And that's basically mimicking what a lot of the pharmaceuticals try to do. Most patients who have active disease, with autoimmune disease, if they're on biologicals or other medications, is usually to try to calm the immune system down. And so with autoimmune illnesses, I generally start patients on rather high doses of CBD with the hope that it will calm the immune system down and let it readjust. And once we see that some symptoms are starting to improve and that they're feeling better, then I take those doses down out of that range that I would anticipate that are immunosuppressive, and more to just keep those anandamide levels and those THG levels to the extent that they're able to activate these receptors and alleviate a lot of the symptoms they're having. So I generally see patients have decreased pain. They have definitely decreased anxiety and depression because the THC in particular is mood elevating. Those who have muscle spasm, particularly in something like multiple sclerosis, both of these cannabinoids are muscle relaxants, so we see improvement there. Both cannabinoids can help with sleep. A lot of times these patients aren't sleeping well because of pain or because of anxiety. Anxiety can wake you right up out of a deep sleep. And so we see better sleep, we see reduced pain, we see improvement in mental clarity. And but it's like almost anything else in nature. It doesn't work for everybody, but when it works in a big way.
You talk about cannabinoids, and so a lot of, the buzzword right now that everyone's hearing out there is CBD, CBD, CBD. I mean, you can go to your gas station and get CBD, and so, be careful what's out there because you're putting this into your body. Make sure whatever products you use are tested. I've heard a lot of your talks, and I know you're pro CBD. Can you talk about the other cannabinoids, why THC, even minute amount of THC would work? Do you get this? Because I always hear this. I want the medical portion of the cannabis plant. Not the
regular. They're both medical. They're all medical. All of the compounds in the plant are probably medical, even the ones we have yet to identify. Yeah. And I very rarely, the only time I recommend CBD all by itself is for a patient who's working who is at risk of random drug testing, because even the small amount of THC in some of the products that are over the counter could be enough to trigger a drug test, and it could jeopardize their employment. But I am of the belief that these cannabinoids work better together. And I generally start with high CBD ratios to THC so that the patient, because I see a lot of cannabis naive patients that they've never used cannabis, and THC can be disconcerting for some patients. It can be dysphoric. It's not always euphoric. So dysphoric means that it makes you uncomfortable, you're edgy, it can increase your anxiety. So I always like to use CBD and THC together, and starting with higher doses of or ratios that are higher in CBD than THC. So the patient can get used to it. And if they do well with that ratio, we stay there. But if we're not getting the effect we need, especially with pain, then we gradually increase the THC so that the patient can become accustomed to it, so they can use it without the intoxicating effect, because patients need to drive and they need to go to work and go to school, and it's not so great to be intoxicated when you have those things to do. And by using CBD and THC together, we can get the benefits of the THC in terms of activating those pain receptors and not have the intoxicating effect. The CBD will kind of knock the THC off of the receptors in the central nervous system. So a lot of patients can get the benefits of the THC without being stoned, for the common term. But that's not to say that these other cannabinoids aren't important. I use a lot of CBDA. CBDA is a raw plant. It's an acid. I use a lot of THCA. It's a good pain reliever. It's not intoxicating. We use CBG. Sometimes a lot of these other cannabinoids have actually more anti-inflammatory effect than CBD or THC. So I use them all.
In your description, how many cannabinoids? Because you hear, I always say plus or minus, because you hear everything from 120 cannabinoids to 160 cannabinoids, and right now I'm at the 140 mark, right? I'm splitting it down the middle. Are you around there? Because I've even heard people say 300, because more are being introduced each and every day, and they all have, and as you mentioned, they're all medicinal. You know,
I
they
think they're
all
all
have
medicinal. And I stay around the 150, and
what
that's usually what I'll
150.
commit. Yeah, the 150. I was like, because that's what we know. Um, I think they're more,
Yeah.
but right now I just said, well, we know that there are probably at least 150 compounds in the plant that are particular to the cannabis plant.
Uh-huh.
And so what the real number is, I think we just know the tip of the iceberg when it comes to this plant. There's so much we don't know.
And so what do you say for patients that are listening that unfortunately don't live in a legal state and have legal access to a product?
Well, most states, almost every state, they have legal access to CBD, or CBD with up to 0.3% THC, which is by definition hemp. Yeah. And a lot of patients will have a good response to CBD, especially autoimmune patients, because that CBD it's activating these other receptors that are so involved in the immune system. If they have pain and they don't respond to what's available with the small amounts of THC, I generally write a prescription for a pharmaceutical THC and add it to that CBD. And I've had
Marinol?
Yeah, I've been using Marinol for about 4 years, and I started using it before Maryland got their dispensaries. I use it a lot in my Virginia patients because their dispensaries haven't opened. But for chronic pain patients, I generally will combine the Marinol with a vetted CBD product. And I cannot overemphasize how careful you have to be with CBD. I have gotten to the point now where if your doctor recommends it, if they have a brand that they have investigated, if it's you just have to be really careful, because even with these certificates of analysis, a lot of them are adulterated. There's a lot of junk out there. There are products out there that have no CBD. I was in a store, kind of a healthy, wholesome, healthy store, very small chain, and they had CBD products that were made from hemp seed. Well, hemp seed doesn't have CBD. There's no CBD in the seeds. So if it's hemp seed oil, there's no CBD in it. Then they would have had to have added CBD. Or I saw one product that said the CBD came from orange peel. I'm not aware of any CBD that comes from an orange peel. And I was, kind of wagging my finger at him and said, you shouldn't be selling this and marketing this as CBD. People need this as medicine. And there's no CBD in orange peel. There may be limonene, and that's a good analgesic and it's anti-inflammatory, but it's not CBD. So you have to be careful about the CBD products wherever you are. And there's certain brands that are absolutely top-notch, but there's a lot of junk out there too. So you have to be careful.
And ask questions, just because also too that it's in your doctor's office, your chiropractor's office, your dentist office, your massage therapist, your acupuncture office, doesn't mean that it's the top quality. I just came back from my chiropractor's office and I was kind of blown away the stuff they had in there that they were selling. And so a lot of people are jumping on this CBD bandwagon. So ask questions. Make sure that they do have lab test results. But like Dr. Frye was mentioning, some of these labs, aren't really testing for what else is in there. You need to be careful for mold, pesticides, metals, toxins, besides the cannabinoids, if it's coming from an orange or the
hydrocarbons. Some of these products they tested out and found synthetic cannabinoids in them. And periodically I'll send a batch off to get tested myself, because that's the only thing. And there's one lab that I trust, and I send it and get it tested.
Is that in Northern California? Is that in north of you there?
Yes, I have to say it's in Massachusetts.
Okay. Good. Um, you talked about limonene and the benefits of, and for our listeners, have you heard the term "stop and smell the roses"?
Mhm.
That's the
And
rose.
that used to be a way for people that some of the dispensaries used to guide patients to a particular plant. They said, well, just smell it. And if it appeals to you, if you like the smell, then that may be what your body needs. But yeah, the limonene, I generally use the names of the plants. I said, well, if it has lemon or some kind of citrusy name, oftentimes it's going to have a lemony aroma, and that means that the limonene may be higher in that particular variety.
Can you go into what terpenes are? Because that's exactly what the terpene is what you're stopping and smelling. So,
Yeah.
smelling a lime, smelling a lemon, smelling a pine cone, that's the essential oils. Excuse me. And those are terpenes. And can you go into terpenes and how they're also part of healing?
Absolutely. Terpenes are the compounds that are found throughout the plant world that give plants their medicinal and their aromatic benefits. So limonene is anti-inflammatory, it's pain relieving, it's mood elevating. It's found predominantly in citrus rind. Beta caryophyllene is found in a number of plants. It is also good for pain. It's found in I believe it's found in black pepper, hops, which is a cousin of the cannabis plant. There's pinene that gives a pine forest its piney aroma. It has antibacterial and antiviral properties. It's a bronchodilator. Cannabis used to be used to treat asthma back in the turn of the century, going from the 1800s to the 1900s. So, we can use cannabis even to treat something like asthma. There are a lot of terpenes. Myrcene is muscle relaxing. It's relaxing. Linalool is found in lavender, and it tends to be higher in the chemovars, or the varieties of cannabis that we find to be more effective for treating things like anxiety or seizures even. Nerolidol is good at sedating. So a lot of these cannabis varieties that are known to be good for sleep, for helping with sleep, maybe high in nerolidol or myrcene or linalool, some of these more relaxing terpenes. So these terpenes and cannabinoids all seem to work together in what the scientists who first discovered these, the THC, well, who first really isolated THC, calls it entourage effect. So that's why sometimes when we see these CBD isolates or THC isolates, where it's just the CBD or just the THC, that they may not work as well, or you may need higher doses of those types of products because they're not getting the benefit of all these other compounds, like these terpenes, kind of massaging how that plant is going to affect a patient. So I'm a big believer in the whole plant concept. I just find that I can have patients who are having pain levels of 8 to 9 to 10 out of 10 and respond to 2.5, 5 milligrams of THC, because the THC is in a product that has all of these other compounds. Whereas if they're using isolate, they would need much higher doses of that same cannabinoid.
You brought two. Let me before I go into the dosing, and I'm glad you brought that up. I love Corinne's description with the entourage effect. It's like baking a cake and leaving out the eggs or the flour or the water. Something's missing. The combination of everything, and everything, all the cannabinoids and the terpenes are very beneficial in bringing the body back to balance as well. That was my next question. A lot of patients, probably not as many today as they were. I remember I used to speak, Corinne and I would speak at events, and I would ask, like at senior communities, and I'd ask the room, how many people think the only way to consume medical cannabis is via smoking? And you would have half the room that would raise their hand. Then we'd go into the different products. And so with your patients fighting these autoimmune diseases, what are you recommending? Is it a tincture? I know a lot of patients I've worked with Crohn's have taken a heavier oil or vaporization. And so what are you seeing with your patients? And more is not better. And I'm glad that you talked about the 2 milligram, the 5 milligram.
Right. I'm not a big, I don't think inhalation is necessary for most things, especially for chronic illnesses, because while inhalation is like taking cannabis IV, you're going to get a higher plasma level and it's going to get in faster. You're going to start feeling the symptomatic relief quicker. It only lasts 2 to 3 hours. So to treat a chronic problem that's present, all the time, inhalation is a very inefficient way of treating it. I like tinctures because the onset of action isn't that much longer than inhalation. It might take 20 or 30 minutes to start working, but when you put the tincture under your tongue, hold it there for not too long, maybe about a minute or so, and then swallow it, where it has to go through the intestines and through the liver, you're going to get a much longer duration of action, so that you could get 5 to 8 hours of action from that dose. So I do think inhalation has its place for treating an acute problem or a severe problem where you need something in quickly. You're having severe pain, your back seizes up, severe muscle spasm, you feel a migraine coming on, or if you just need something very short acting, you wake up at 3 o'clock in the morning and you have to get up at 6. That's not enough time to really take a tincture for it to get through your system so that you're not groggy. So a puff or two is really helpful, can be really helpful for getting back to sleep. Or a patient who has trouble falling asleep but doesn't have any trouble once they fall asleep, they stay asleep, they don't really need a tincture. So inhalation can be very appropriate for that. Inhalation is great for sex. You may just want just a little bit just to kind of get things going, but you may not need that effect for 5 to 8 hours. So inhalation can be, very helpful for that. So I tend to mix it. Capsules I tend to reserve for my GI patients, because the GI absorption is rather unpredictable, that's actually a benefit for patients with inflammatory bowel disease, because you have a lot of medicine that's staying in the intestines. The intestines is filled with immune receptors or receptors that are part of the immune system. And I just find that if I have a patient who takes a capsule with CBD or CBD and CBDA, that they just get better results. So I use different modes of delivery depending on the patient, depending on the condition. But for treating a chronic problem, I do strongly recommend using tinctures. If they have a problem with a tincture, I'm sort of okay with something that'll hang out in the mouth like a troche or a gummy. But I tend to steer away from some of those products. One, I think some of them are kind of stripped down. And then a lot of them have sugar. A lot of them have these emulsifiers and things which have other problems. There are other problems to some of these additives. So the old-fashioned tincture is probably my favorite.
It's funny. My mom the other day said, does CBD work on arthritic? And I said,
oh, yes.
You don't have arthritis. Why are you asking? And she said, her girlfriend said she just watched a show, and I love Dr. Oz, but it was a Dr. Oz show and he was recommending gummies. Oh, she said, do gummies work for, CBD gummies work for arthritis? And I said, why are you asking that question? So she said her friend, and she said she saw it on the show. And I said, Mom, what's really disappointing about that is, yeah, it would probably work, but sugar is probably the worst thing an arthritic patient could use.
It's inflammatory. Yeah.
And I said, this is the stuff that just disappointing. There's some great information out there, but there's a lot of misinformation out there. And then when main media gets involved like this, that everyone follows. And I mean, if my mom didn't talk to me or someone else who knew something about cannabis, you know, her girlfriend probably would have run out and sucked in these gummies that are loaded in sugar and stuff like that. Are you finding with all these different ailments that we were talking about in the autoimmune, I mean, the list goes on and on and on. Are you finding certain things work best for each? Because it's not a one size fits all. So are you seeing a combination of THC, CBD works better with fibromyalgia patients? Are you seeing, you know, high CBD works better for Crohn's, lupus, et cetera?
Yes, and this is just the patients that I see. It's all observational that I find that the inflammatory bowel patients do best with CBD and CBDA. And that's not to say that THC is not helpful for a lot of patients, but most of my patients do very well with CBD and CBDA. And I tend to use capsules, or if they're using an oil that has a fair amount of CBDA in it. For fibromyalgia patients, I find that they have more pain issues, and the THC does seem to be more helpful. But it's rare that I have patients that need more than, let's say, a 1-to-1 ratio of CBD to THC. That seems to be quite effective. And again, most of my patients, are, at least pre-COVID, were driving and needed to be at work and couldn't, could not risk being impaired, or intoxicated.
What was your, I missed what you said.
I said that they can't take the risk of being on their job and appearing to be impaired.
Impaired. No, I said intoxicated right when you said impaired. I didn't hear what your description was.
Yeah, that's not my other word.
Yeah, yeah.
Now, impaired and intoxicated is great if you had a terrible day, or you just want to unwind and you're in your home, you want to get some relief. Sometimes, that intoxication can be so therapeutic. It's almost a respite for patients who don't feel good or who have pain. And sometimes they'll say, "Oh, well, doc, it doesn't take my pain away completely, but when I use it, I just don't care." That's the beauty of the THC. But a lot of patients can't be that way and be at work and not get in trouble.
And you run into that. And that's a question that comes up. I have to work. I can't, or I work for a company that randomly drug tests. What do I do? And so in situations like that, do you ever recommend, and I don't know if you're still practicing where you're writing prescriptions for pharmaceuticals, are you finding, are you working with any patients that combine? The reason I say that, I've worked with fibromyalgia patients for quite some time, and they are finding success by having small amounts of a pharmaceutical with cannabis, and that is their sweet spot. And it's something that some of these patients wake up at 3 to get out of bed by 6. I'm very fortunate, knock on wood, I don't experience that. And
yeah, that is stiffness. Stiffness is another common symptom with a lot of these autoimmune illnesses. If they're on a nonsteroidal anti-inflammatory, they can often get better pain relief by combining cannabis with something like ibuprofen or meloxicam. They tend to work with the same endocannabinoid system. If they're on an opioid, cannabis, part of the beauty of cannabis is that it automatically increases their sensitivity to the opioid by crosstalk between these cannabinoid and opioid receptors. So when I have patients that come in on opioids, I can almost immediately cut their opioid dose in half, if not by 75%, and they will get better pain relief because, unbeknownst to a lot of patients, chronic use of opioids causes a condition called opioid-induced hyperalgesia, so that the more you take the opioids, the more pain you're going to have. You're more sensitive you are to pain. By cutting that dose, you have kind of alleviated tolerance to the opioid. You're kicking out the opioid-induced hyperalgesia, and patients can be a lot more comfortable on a much lower opioid dose than they would if they were not using cannabis.
You mentioned steroids, and a lot of fibromyalgia patients are using a type of a steroid to battle their autoimmune disease. And so how do you see steroids and how do they compare to CBD or the cannabis plant?
Yeah, steroids are nothing but a way of suppressing the immune system. That's what they're used for, as an immunosuppressant. The problems with steroids is that you have adverse effects from so much steroid in your system that you have issues with weight gain and irritability, increased anxiety. Some patients don't tolerate steroids. They become so irritable. Patients, it's not unusual to gain 20 or 30 pounds on steroids, and steroids can impact they act just like that cortisol from chronic stress, is that they increase insulin resistance. So if you're on steroids for an extended period of time, especially high doses, that's a really easy way of developing a type 2 diabetes. So you have none of that with cannabis. You can get an immunosuppressive response if you dose it properly. That's why I do those high doses of CBD for a couple of weeks and then bring it down. But even at the high doses, we don't see, if anything, CBD can help with glucose metabolism and lipid metabolism. It's actually an appetite suppressant. You don't see the weight gain. It can actually help. Both CBD and THC can actually rev up energy expenditure a bit. That's why chronic cannabis users, for the most part, have lower prevalence of obesity, because even though their caloric intake may be a little higher than those who don't use cannabis, at least the THC, they're going to burn those calories, or a lot of them burn the calories more efficiently. So you just don't see the weight gain that you would think, knowing that THC in particular is an appetite stimulant.
Because I know that was one thing Corinne said, I don't want to do that because when I tried cannabis in college, I ate and I ate and I ate, and I don't want to go back there. And so that's what a lot of patients I talk to, am I going to get the munchies? But in the case of Corinne's father, when we went through this, I know we're going all over the place here. We didn't know the benefits of cannabis then. We knew that it was an appetite stimulant. And Corinne and I came across a study that showed 40% of cancer patients pass a malnutrition before the cancer takes over. And so we said, okay, he had a 2-week life expectancy, and they say, let him eat and he'll pass peacefully, compared to just wasting and wasting and wasting. And it was the complete opposite. He ate, energy came back, his complexion came back. So we've seen the benefits of this plant. For our listeners too, when you're talking about steroids, it's not injectables, what you're hearing about in the news.
No, these aren't the steroids for building muscles. These are those are anabolic steroids. They're completely different. Generally, patients with autoimmune illness might be on something like prednisone or dexamethasone, not the
pill, or is that a topical?
No, they would be for severe autoimmune illness. They would be taking them orally. Now, if they have a rash, particularly let's say psoriatic arthritis, oftentimes those patients will have skin involvement and have psoriatic plaques. Those patients would more than likely be on a topical steroid. And you have to be careful with those. We use topical steroids to treat things like psoriasis and eczema, but too much steroids over too long a period of time can actually thin the skin and leave some marks in the skin. And not surprisingly, topical CBD works really well for eczema, psoriasis, insect bites, itching, damage from the sun. It reduces the inflammation in the skin. There are a lot of benefits.
Back to the duct tape, roll of duct tape, because I've spoken to parents in this industry, actually parents, and their kids are, at camp, of course, not this summer, but they send their kids off with a bottle of CBD for suntan burn or sunburns as well as insect bites. And it's like, I don't want to, it's a million and one uses too. And so, what are you seeing some of the major side effects of autoimmune disease that are happening to patients? Are there any long-term, besides depression and everything else that comes along with not being 100% balanced?
Well, it depends. I mean, that's a really hard question to answer because autoimmune illness isn't just like one thing. So with something like, let's say, multiple sclerosis, you may see a decline in function and mental function. You have demyelination of the nerves, which is progressive. So the effects of that disease are going to be different from the effects of, let's say, someone with inflammatory bowel disease who may have chronic pain, chronic inflammation, so much diarrhea that they are malnourished, they have a malabsorption syndrome, or they develop fistulas, these little tracts that aren't supposed to be in the intestines. They can perforate the intestines and have a bacterial infection that gets into the blood. So you can't really answer that question because autoimmune illness is just not one disease or one disorder. It depends on what the illness is and what it's affecting. Some things like lupus that affect the kidneys. Somebody might develop chronic renal failure from lupus. So that's a really hard question to answer. We would have to be talking about one specific illness for me to go into detail.
More cases of autoimmune diseases now than when you first became a medical doctor, and why is that?
Well, I think there are more. When I first became a doctor, well, for part of my career, I was doing pediatrics, and then I was doing anesthesiology. And in anesthesia, it's mainly helping people go to sleep, waking them up, and managing pain. But I actually see more autoimmune disease now that I'm practicing cannabis medicine because it helps so much. And yes, I think there's an increase in autoimmune disease. I think there are a lot of exposures. We see certain foods that are highly inflammatory, things like the way they're grown, like wheat. The incidence of gluten sensitivity is astronomical compared to 30 years ago. We rarely saw celiac disease or anything that even remotely mimicked celiac disease. Now it's highly probable to see gluten sensitivity, which is what we call an IgG sensitivity, because of the way things are grown. And a lot of these pesticides and herbicides and fungicides that are used on foods like corn and soy and wheat, they negatively impact the endocannabinoid system. So there are a lot of foods that I get patients to avoid. Even emulsifiers like polysorbate 80 and lecithin, they're finding that these impact insulin sensitivity and energy expenditure and the microbiome, your bacterial balance. The meat that we have is not the same meat that we had in the 50s. These animals, this feedlot, they are fed enormous amounts of omega-6 rich grains so that they gain weight quickly. And I don't care what you say. They say they don't give them hormones, but I've never seen a chicken with a wing that big in my life ever. Seeing chickens and living in rural areas.
I'll go by the high school. I mean, I graduated high school. I was a late bloomer. I graduated high school 5'6". I'm 6'1" now. I see high schoolers, freshmen that are 6'4". They look like they can play in the NFL, and I'm thinking, what chickens are they eating?
That's right. There's And omega-6 is actually, it's important. Omega-6 is an important fat to have. It's the precursor to a lot of the neurotransmitters, even our endocannabinoids. But the ratio of omega-6 to omega-3 should be about 4-to-1. And in this country, it's 16-to-1. All this omega-6 also downregulates the endocannabinoid system so that it isn't able to do the job it's supposed to do of keeping these things in balance, of keeping that immune system in check. Our immune system is supposed to protect us from invaders. And once it's done its job, it's supposed to settle down. Just with COVID, the devastating part of COVID is that you have this crazy immune response called a cytokine storm, where you just have a flux of all of these inflammatory mediators. So it's the damage that's done by our immune system. And it's very much like an autoimmune illness, but at a much higher level.
Talking about this, do you talk about diet with your patients, and can diet help?
Every one of them, yes, indeed. I have a list of foods that I refer to as the Hateful Eight. And these are the foods that are most commonly implicated in IgG sensitivity, where you have these molecules that get into the system through the intestines, through what they call leaky gut. You don't have tight junctions. These molecules get in and stimulate the immune system to cause all these problems. And it's, let me see if I can remember them all. It's wheat or gluten, soy, not necessarily unfermented soy. So tempeh and tofu are okay. But wheat, gluten, soy, corn, eggs, chicken eggs. So if you're going to eat eggs, eat just a few of them, or try duck eggs. They seem to not be as inflammatory. Tomatoes may be more because of the nightshade issue, where these alkaloids can stimulate the immune system in some people. Shellfish, grapefruit, and there's one I'm missing. But these foods are very commonly implicated in an abnormal or chronic immune response. And if patients will eliminate these from their diet, they often find that their brain fog goes away, their joint pain goes away. Sugar is a big problem. It's inflammatory. There's sugar in a lot of processed foods. There are emulsifiers in these processed foods. A lot of the stuff that's in processed and packaged foods is really making people sick.
Have you changed your diet over the years?
I have. Yeah. I have. I was a big beef eater, and I have to say that I usually ate good beef. I would eat beef like from the farm down the road, where I knew the people and I knew these animals, and they were grass fed and well cared for, maybe a little grain finish at the end. But I've pretty much eliminated beef from my diet. Most meat. I can't say that I'm vegan. That's something that I'm kind of working my way to, but I have definitely increased the plants in my diet. Most of us don't eat enough. The USDA says 4 or 5 servings, maybe 3 or 4 servings. You really need like 9 to 10 servings, because a lot of the vegetables and fruits are micronutrient depleted from the farming techniques. So we need more to get those micronutrients that really help us be healthy at a cellular level. So it's something that has evolved over the last few years. I think of seeing patients chronically ill, a lot of obesity, and how these things are just making people miserable. And it's affected me, and I definitely have changed my eating style.
Corinne and I always ate healthy, but this past January, I went vegan. I said, let me try it out. Mm-hmm. And, I'm sleeping better. This is the first time I feel like I don't have any inflammation on the inside. Mm-hmm. It's a pretty good feeling. Corinne and I watched this movie a documentary a few years ago called the Second Brain. The brain, and the gut.
Oh, the bacterial, the enteric nervous system. Yes.
Totally makes sense. I mean, when we're off, in your gut, you're off. If you eat too much of anything, you're like, okay, well, won't do that again.
And they show that animal protein, when you look at animal protein versus plant protein, that animal protein absolutely changes the microbiome, and you have much more, a higher counts of the more pathogenic bacteria than the beneficial bacteria. And that when you switch to a plant-based diet, that you get a much better balance of beneficial bacteria to non-beneficial bacteria. The actually even using cannabis actually shifts that microbiome to a more beneficial. So even people who don't really need cannabis for a chronic problem, I say, oh, if it's available, put a little pinch of it in your smoothie. That CBDA, that THCA, other compounds in that plant is, just for well-being. It can be very helpful.
So I'm glad you said well-being. So would you recommend healthy bodies or bodies at dis-ease? Do you recommend cannabis, on a daily basis?
Well, certainly if they're symptomatic, I recommend on a daily basis. Once they're no longer symptomatic, and I usually see patients who are sick, that's just the nature of my practice. They don't come to me for wellness. Then they can, because cannabis is expensive, and I don't think that all the benefits go away in a certain number of hours. Once things are back in balance, then sometimes I'll recommend, just a small dose, maybe 2 or 3 times a week, just to kind of remind that endocannabinoid system. And certainly when they are feeling better, and if they enjoy the euphoria, or if they experience euphoria from the THC, that if that's a good way to unwind and relax, it has more benefits than a martini. So, why not?
What do you recommend for patients who are cannabis naive or just getting into this industry to see this as another option, but are afraid to have this discussion with their doctors, or want to have this discussion with their doctors? And what would you recommend them starting to kind of chisel away at this stigma that's in this industry?
Well, I encourage patients to talk about it with their doctors, and the response they get varies widely. I have patients whose doctors say, okay, well, that sounds like a good idea, or I don't do certifications, but here's the name of a doctor who you could go see. And then there are others that are like, they don't want to talk about it. They cut the patient off. When there's a doctor like that, if you're not glued to that doctor for by some contract, then that might be time to start looking for another doctor, somebody who's a little bit more open, because generally the doctors who are very rigid, and you have a patient who's not responding to conventional therapy, there's little likelihood that you're going to really get better, because usually they have tried everything in their pharmaceutical arsenal. And if you're not getting better, then sometimes I find that the DOs are more open. The doctors of osteopathic medicine, their training is a little bit more focused on wellness than the medical doctor. And I'm an MD, I'm an allopath by training, but our training is more disease oriented. We're very, we tend to be very rigid. I just, every patient's different, and their relationship with their doctor is different. But I think if you have a serious condition and you are not feeling good and you are not improving, that you can bring it up with your doctor. And if they react negatively, then that might be an impetus to find another practitioner, because not all MDs are like that. There are plenty who are open to the discussion. They may not know anything, but they should be open to you trying something and be supportive. You shouldn't be scolded or penalized in any way for asking about the possibility of using cannabis for your symptoms.
Do you ever have patients invite their other doctors in on the call with you and say, and have everybody on the same? I know you do telemedicine.
That has never happened. I have, there are a few doctors in the area that tend to send patients to me when their patients ask. And some of them from major universities, major specialty groups, even spine and pain. I get patients from some pain management practices. I think what it is that a lot of doctors don't want to talk about it. One, because they don't know the plant, they don't understand the plant, they don't understand how you can use cannabis and not be at risk of becoming addicted or a pothead or something. And they also, for a lot of physicians, they don't like the idea of sending their patients to a dispensary where they don't have control over what the patient is advised to purchase, where you have some dispensaries where the guys are very knowledgeable despite not being healthcare providers. And you have to remember that they're not trained as healthcare providers unless you're at a dispensary that has a medical director. But at the same time, you can get somebody who's, a kid that's just been there a week and, he's 19, 20, 21 years old and they don't know anything. But they know kind of like, oh, well, this will get you high, or this I like, and so it's such a range of what their patients are exposed to that they really are very uncomfortable doing that. And even though I give in writing my patients what I'm recommending in terms of their approach, in terms of CBD to THC ratios, what to start with, how often and by how much to titrate up, because you don't want to overshoot. Cannabis doesn't work very well if you take too much, or it can cause your symptoms to increase if you take too much. Despite giving every patient that in writing, I'm still faced with, but this isn't what I'm no better. They gave me this. I said, but that's not what I recommended. They said, oh, well, they didn't have it. And they said to get this one. I said, well, no, another dispensary would have it. So I'm constantly fighting that. There's some states where they do have to follow the doctor's suggestions, and in other states it's like going to CVS with your prescription for ibuprofen, and the pharmacy tech says, "Oh, would you like a little morphine sulfate to go with that?" So we have no control, and a lot of doctors don't like that at all, and so they don't want to consider it.
And I can see, and that totally makes sense. It totally makes sense. And so what I recommend too, if a patient and their doctor's not open or really doesn't know much, don't be afraid. It's not illegal to ask the question, but don't be afraid to ask him or her, can you recommend somebody who
Right.
may? And I'm certain, I'm almost positive that they'll know somebody in their circle that is that integrative doctor and open-minded, like Dr. Frye and a lot of the other doctors out there too. And so,
and if I can put a plug in for the Society of Cannabis Clinicians, that you can, patients, if their doctor is resistant, go on the website, see if there's a clinician in your area. That these doctors are not just going to push cards out. They're going to treat you like a patient and follow you. Yeah.
They're not the pot docs, and unfortunately, there are a lot of them out there, and laws are changing. I should say there's a lot of them out there, but before in the day, before it became recreationally legal here in California, we always heard, here's your recommendation, call me in a year if you want to renew it. And I just think for a cannabis naive patient who's really trying to look for something to help with their autoimmune disease or any other type of ailment, they do need that hand holding. And so that's why in the middle of the show, I said, make sure a medical professional is involved. They look at age, the weight, the current health condition that you're in, the sensitivities and other medications. More is not always better. You might have success. I was mentioning it, 2 to 5 milligrams, not 100 milligrams. Some people need that.
Some people need it, but not many. Yeah.
So, well, Dr. Frye, I can't thank you enough for being on and be supportive of what we've been doing over the years, it's always great to see you, and I'm glad that you're healthy and always smiling. You're always smiling when I see you. So thanks for being here.
Thanks, John.
I'm going to throw this curveball at you. Ready?
All right.
You have any closing words that you want to share with our listeners?
My closing words. Let me see. What should I say? I would say that this plant we've had an intimate relationship with this cannabis plant for probably more than 5,000 years. And it's been part of the medical toolbox for hundreds of years, that any concern about cannabis being an illegal substance, you have to just remember that the reasons it was made illegal had nothing to do with science or medicine, and it was a strictly socio-political situation that prompted this war against cannabis, that it doesn't work for every person, just like no medication, no pharmaceutical works for every patient. But when it does work, it works in a big way, and many people find relief and get better and feel better and are better because of this plant.
Well said as always. How can they find you?
I'm online. You can Google me. You can Google my name, or Tacoma Park, or Tacoma Southeast Integrative Care. You can Google my book, the Medical Marijuana Guide, Cannabis in Your Health. It's available in all bookstores and Amazon. I'm licensed in several states. If I'm not licensed, I can do an educational consultation with patients almost anywhere, and I've done those internationally. It's not the same as a doctor-patient relationship, but I can certainly review your symptoms, your medications, and give you some guidance.
Yeah. So. And I can attest to that. Dr. Frye consulted for United Patient Group for years, and so give her a call. And website, can you mention your website too, please?
It's www.tacomacare, TAKOMACARE.com.
So, Dr. Patricia Frye, thank you for being on again.
Thank you, John.
We'll do more of this as well. And everyone, hope you have a wonderful day. This is John Malanca with United Patients Group. Be informed and be well. We'll see you soon. Bye-bye. Hey everybody, John Malanca with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA, that's right, USDA certified organic hemp and CBD brands. And all of its hemp is grown from the perfect topography and climate found in Colorado. It is a family-owned business and is deeply committed to the science of providing only the purest hemp and CBD products for the best results and most beneficial experience. Its mission is to bring the therapeutic value of pure, organic hemp and CBD to people who seek supplemental relief through the use of healthy, natural products. Aspen Green is free from toxins and runs up to 8 different lab tests from bona fide third-party labs throughout its product line. It holds in high regard 3 foundational principles that guide every aspect of their business, actions, and interactions with their customers, partners, as well as their community. These are quality, integrity, and transparency. These will always remain at the hearts of their efforts to bring their beneficial products to consumers. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Again, UPGCBD for 20% off at aspengreen.com.